First of all, let me take a step back to explain what is the Lusaka Agenda to make it really practical for the audience. The first point is the Lusaka Agenda came out of a process, the process that was initiated around 2023 as the global health community wanted to evaluate the progress and the achievements of what is called, was called, that are still called at this time, the global health initiatives. Those are initiatives that were established to address global health issues, high burden diseases like HIV, TB, malaria. The Global Fund was established to address HIV, TB, and malaria. The Global Immunization Program, which is supported by the Gavi Alliance as another global health initiative. And we also have CPHIA, which looks at the consortium. I think CPHIA is one of those major global health initiatives that was established. Yeah. We also have on the World Bank side what is called the GFF, the Global Financing Facility, another global health initiative that caters mostly on maternal and child health issues. So the process of evaluating those global health initiatives was an inclusive one, which led to a set of recommendations. And those recommendations were endorsed in Lusaka at the margin of one of the CPHIA. Yeah. The CPHIA, which was organized in Lusaka, was the 2024, the end of 2023 CPHIA, December. And by mid-December, the Lusaka Agenda was officially launched. So there are a set of 5 strategic shifts that we need to very much explain to the audience. The Lusaka Agenda, first of all, prioritized the centrality of national strategic plans, and calls for partners to align around one national strategic plan. And this is very much focusing on investing, on strengthening the primary health care within those countries. So the one plan is the top priority, centrality of the national plans. The second one is the alignment of partners around that national plans. And that alignment should also promote the integration of services. And this is also an important dimension of primary health care, the integration of services to reduce not only duplication, but also to optimize the resources that's available for primary health care. The third one is, as the national plan is supported by partners, the priority investment should come from domestic resources. So the Lusaka Agenda is also promotes domestic resource allocation to support primary health care. So that's the third pillar. And then the fourth strategic shift that the Lusaka Agenda advocated was for the global health initiatives to better organize themselves and reduce also fragmentation, as well as reducing the burden on the country applicants, when they are applying for grants or for funding. And you see that partners like Gavi are already addressing that by reducing the number of windows of application that any country can utilize to access funds. Beyond that coherence that is required from global initiative is now asking to all of them to try and find a way to align their mechanism and reduce the burden on member states when they are applying for resources through Global Fund, Gavi, GFF, or CEPI. And the last shift is the one that now promotes research and development on, let's call them, in countries that are beneficiaries of global health initiatives, in a way that the commodities that represent close to 60 to 70% of the spending of those global health initiative investment can contribute to the local economy of those countries. And that's where the local manufacturing becomes another top priority that the Lusaka Agenda is promoting. So those are the 5 strategic shifts. Now, how does that relate to Africa CDC strategic plan? That's a very valid question. Let me take a step back to share with you what is the motto, the vision of Africa CDC when it comes to health security on the continent. It relies on 5 pillars of the new public health order. The first one is about strengthening our national public health institutions on the continent. And strengthening our national public health institutions will require a second pillar, which is the domestic financing. And the domestic financing is, as you can see, similar to what the Lusaka Agenda is also promoting. And national public health institutions at central level, but you can also trickle down to the district level. Now that's where now you could consider a strong primary health care as part of a decentralized structure of your national public health system. And then the third pillar of the new public health order is the workforce. As you know, the continent continue to face a critical shortage of health workforce. And Africa CDC 2017 received a clear direction of travel from our head of state to train and deploy 2 million community health workers as part of a stopgap as we continue to recruit and train medical doctors and nurses. I can report that by last year, 2024, the continent has recorded about 1,400,000 community health workers through a survey that we conducted with UNICEF as a partner to Africa CDC. So that pillar is a pillar that is also critical because community health workers are part of the primary health care strategy of the continent. They are piece as part of our workforce strategy, and the advocacy here is to have community workers who are not only trained, protected, but they have to be fairly remunerated. And that's a clear advocacy that Africa CDC is making with the AU Commission. And we're happy to report that close to 60% of our member states have already taken that step. And we are definitely advancing that strategic pillar of the new public health order. The fourth one is local manufacturing. And you can see the similarity between that fourth one on the new public health order and the 5th shift of the Lusaka Agenda, which really calls on the African continent to not only be a receiver of vaccines, diagnostics, and therapeutics that are produced outside the continent, but also to be part of the global manufacturing capability, manufacturing powerhouse. And this is the direction of travel that since the COVID-19 era, our head of state gave a clear marching order to have by 2040, 60% of the vaccines utilized in Africa should be procured from African manufacturers. And there are significant progress in that space that we can talk about later. So let me now touch on the last pillar of the new public health order, which calls for respectful and result-oriented partnerships. And now, that pillar is definitely the one that now brings the whole concept of the global health initiative that the Lusaka Agenda is restructuring to align with an imperative of the new public health order, which is our partnerships should be result-oriented, our partnerships should be respectful of our priorities, aligned to our plans, and building sustainable systems.